Tonight, 12 News Investigates looks into crucial questions about what will happen once a coronavirus vaccine gets approved. We know Pfizer says it's close. The company says its two-dose vaccine was 90% effective in trials. So who will get it and when? And ultimately, what should we expect? Investigator Anastasia Bolton found out that Texas has a team that's already been appointed to make these difficult decisions.
There are 29 million of us in Texas. Making sure everyone who wants it has access to the COVID-19 vaccine is complicated.
The vaccine is going to be in limited supply just as manufacturing ramps up.
Chris Van Duzen speaks for the Texas Department of State Health Services.
For that first push, working with large hospitals, large clinics, because they'll have the capacity to immunize a larger number of people.
Van Duzen said vaccine distribution requires many voices. The state put together the COVID-19 Expert Vaccine Allocation Panel, 17 people, including infectious disease experts, emergency management gurus, public health and political leaders. The panel met for the first time Monday. Eventually, it will be making recommendations to the DSHS commissioner.
They will help sort of prioritize the vaccine distribution in Texas throughout those different phases of the vaccine distribution.
How many doses will Texas get? The exact number is not yet clear. Based on the population, Texas typically gets 10% of the nation's supply, Van Duzen said.
But what we expect is the CDC will come and say, okay, Texas, here are the number of doses you're going to get this week. Then the allocation panel will look at that and determine, okay, where are the best places for that vaccine to go? We'll let the CDC know, and then it'll be shipped out directly to those sites.
Van Duzen said health providers have to be signed up with the state to be able to administer the COVID-19 vaccine. So far, more than 2,500 signed up, but more are needed.
We want to make sure geographically we're covering the state and have different kinds of providers as well.
The goal is for Texans to be able to get vaccinated where they usually get health care. We're a ways away from that, but when it finally happens, Van Duzen said providers will let you know. I'm Anastasia Bolton.